From the American Neurological Association, I'm Adeline Goss. This is ANA Investigates. One of the most viewed articles in JAMA Neurology this month is called Risk of Parkinson's Disease Among Camp Lejeune Veterans. In the late 70s and early 80s, the water supply at this military base was contaminated with the solvent trichloroethylene and other volatile organic compounds. The study found that military service members stationed during that time at Camp Lejeune had a 70% higher rate of developing Parkinson's disease than those stationed elsewhere. So what do we know about the relationship between environmental toxins and Parkinson's disease? Our guest today, Dr. Ray Dorsey, thinks these toxins are a major factor driving the rise in rates of Parkinson's over time. Dr. Dorsey is a professor of neurology at the University of Rochester. He lays out decades of research linking Parkinson's to specific pesticides and solvents, including research by Dr. Caroline Tanner, senior author of the recent JAMA Neurology article. Dr. Dorsey spoke to Dr. Sarah Sturdneser, neurointensivist at UC Irvine. Here's Sarah.
Welcome, Dr. Dorsey. Thank you so much for being here with us.
Sarah, thank you very much for having me.
So today we wanted to talk to you about environmental toxins and Parkinson's disease. So let's just jump right in. We'll start with the big picture. What do we know about environmental toxins and risk of Parkinson's disease?
We know quite a bit, and we also know that people have been trying to hide it from us. Dr. Caroline Tanner, for over a generation, has detailed that environmental factors are the principal causes of Parkinson's disease. We identify a lot of genetic causes, but they only account for about 15% of people with Parkinson's carrying one of these genetic mutations. We've known for 100 years that only 15% of people have a family history of the disease. And we know from Dr. Tanner's twin studies that environmental factors are the principal determinant of Parkinson's for people over the age of 50. And then she, over the last 25 years, has told us quite a bit. She told us, one, that paraquat, a pesticide, a very toxic weed killer with 150% increased risk of developing Parkinson's disease. We found out from a British investigative journal called The Guardian that the manufacturer of paraquat knew about its toxic effects, at least according to The Guardian, knew about its toxic effects for 50 years and hid them. As just one example, they fed paraquat to laboratory animals and they developed, in their words, a stiff gait and tremors over 50 years ago. And they didn't seek to withdraw the pesticide. They didn't seek to introduce a new one. They sought to double down under a campaign called Freedom to Sell. And that freedom to sell has likely planted the seeds of Parkinson's disease for the last 2 generations. The second major risk factor is this dry cleaning chemical called trichloroethylene. It's really, really simple. For those of you who don't remember your chemistry like me, I didn't know it until about 6 years ago. And this chemical was first developed in 1864, so at the time of the Civil War in Germany, and it's been used since 1920. So this chemical is 100 years old. This is the same chemical that likely caused leukemia in children outside of Boston and in Toms River, New Jersey. It's the same chemical that contaminates Camp Lejeune. Dr. Tanner and Dr. Goldman, 10 years ago, Annals of Neurology, indicated that twins who had occupational or hobby exposure to trichloroethylene had a 500% increased risk of developing Parkinson's disease. And then this is the basis for their study that we'll discuss momentarily. And then the third thing is a historical perspective. So when Dr. James Parkinson described the condition in 1817, the streets of London, there were only naturally occurring pesticides, synthetic pesticides like paraquat, DDT, and the like weren't developed until World War II or after, and there was no trichloroethylene. So what was Dr. Parkinson seeing on the streets of London? Well, he's seeing what a lot of people are seeing on the streets of New York City and the streets of Washington, D.C. today, and that's air pollution. The air quality in London in 1817 was 20 times worse what it is today. It was twice as bad as it was in 1952 during the Great Smog in Britain, and is as bad as it is in Delhi, India today.
So that's a lot to unpack. Let's start with something you mentioned, which is related to the prevalence of Parkinson's disease over time. And, the numbers you're saying are pretty substantial. How has the prevalence of Parkinson's disease changed in the last 100 years if you're attributing it predominantly to toxicity that has only existed for the last, say, 70 years?
So it's really unfortunate. We have really limited high quality studies on the epidemiology of Parkinson's disease, and that's a substantial shortcoming of our field. And we need to get funders and scientists doing more of this research so we can answer these important questions. There are really, really limited data on Parkinson's disease epidemiology before the 1990s. It's worth noting Parkinson's is the world's fastest growing brain disease. It's growing faster than Alzheimer's disease, which actually worldwide, adjusted for age, is relatively flat. So there has to be something else that's fueling it. If you look at the map of Parkinson's disease in the world, there's a 5-fold variation in the rates of Parkinson's disease by geography. I don't think there's a 5-fold variation in genetics by geography. But areas of the world that are most industrialized, like the US and Canada, have the highest rates of the disease, 5 times higher than the least industrialized parts of the world, like sub-Saharan Africa. And areas of the world that are undergoing the most rapid industrialization, like India and China, have the fastest increasing rates of the disease. China, for example, over the last 25 years, its rate of Parkinson's disease adjusted for age has more than doubled. You don't see this pattern for other diseases. For example, stroke, for which we know we're really good at diagnosing, we have really sensitive measures for doing it. Rates are much higher adjusted for age in sub-Saharan Africa than they are in the United States. Multiple sclerosis, another disease for which we are much better at diagnosing with much more sensitive tools and objective measures, does not have this similar rate of increase that Parkinson's disease does.
So you were mentioning the exposure and the variability of the exposure. Who is at the greatest risk of these exposures?
Research by Dr. Tanner is, again, very helpful to understanding this. She and her colleagues demonstrated that farmers who work with paraquat have 150% increased risk of developing Parkinson's disease. She and others have shown that people who drink well water, live in rural areas, but aren't necessarily farmers, have a 75% increased risk for developing Parkinson's disease. We talk a lot about paraquat, but there are other pesticides. Many of them are fat soluble that are linked to Parkinson's disease. And the study from the 1980s in Canada looked at agricultural areas in France and found that the rates of Parkinson's disease had a near perfect correlation with rates of pesticide use, 0.967, if I recall correctly. Dr. Alexis Elbaz has done a very similar study looking at use of pesticides among French vineyards and found a near perfect correlation between rates of Parkinson's disease and rates of pesticide use. So there's a lot of epidemiological evidence linking many of these pesticides to Parkinson's disease, and their animal models are largely consistent with the same.
What do you think the current regulatory process is that has kind of led to these toxins and exposures persisting?
The deliberate production of ignorance, not knowledge like science production of knowledge. Agnotology is the production of ignorance, often for commercial gain. This is the hallmark of what the tobacco industry did with smoking. Their campaign slogan was "Doubt is our product." So they sought to sow seeds of doubt, saying that you can't be proven, it's not for certain, we need to do more research. All the while they knew it, and they've used doctors as tools, as pawns, as fronts for indicating that smoking was actually helpful when they knew the opposite. And I think the exact same thing is happening with Parkinson's disease. According to The Guardian, the manufacturer of paraquat sought to discredit a scientist and prevent her from serving on an EPA advisory panel on pesticides. According to The Guardian, EPA had been considering banning paraquat since the 1970s. Dr. Debbie, the University of Rochester, where I work, was one of the early scientists who identified that paraquat, when fed to laboratory animals, produces the pathological features of Parkinson's disease. She did that in the late 1990s, so 25 years ago. According to The Guardian, the manufacturer hired a third-party lobbying firm to discredit her work to the EPA, saying that she was, quote, overly opinionated, successfully prevented her from serving on an EPA advisory panel, and instead industry-friendly scientists serve in her stead. Those are the reasons, I think, why paraquat and others remains on the market, why over 30 countries, including China, have banned it, why paraquat over the last 5 years, for which we have data, use has doubled in the United States and is sprayed on farms in just about every state in the union, and is being sprayed on farms as we speak, likely.
So in preparing for this, I actually did a little digging on the regulations that currently exist in the US. And I was interested to find that the reason for the regulations and banning in other countries is actually a very high acute oral toxicity. There wasn't a lot of mention I could find, even in the regulations in countries who have banned paraquat, about Parkinson's disease. In the US, it seemed as though it was restricted, but obviously still in use. What kind of are the regulations, and how do you see them as either being improved from prior or needing additional tightening?
So I'm not an expert on regulation of pesticides, but I would say many parts of the world adopt something called the precautionary principle, where you have to demonstrate your product is safe before it's put onto the market. Very similar to how the FDA regulates drug has to be safe and effective before it's used. In general, in the United States, my understanding is that you have to demonstrate that a product is unsafe for it to be removed. You mentioned these restrictions. We should just be really, really clear that use of paraquat in the United States, a weed killer that's considered more toxic than Roundup, that's been used to commit homicide, that's been used to commit suicide, that the EPA's own webpage says that one sip can kill, its use is increasing in the United States. We should also be clear that, this is all according to The Guardian, for a $400 million product. In the United States, Medicare alone, funded by taxpayers, spends $25 billion a year caring for people with Parkinson's disease. If just 2% of Parkinson's disease were attributable to Paraquat, the United States would be spending more caring for people with Parkinson's disease than the company makes in revenue from sales of this product.
That is a shocking economic breakdown, but obviously also, I think as physicians, we prefer to think about our individual patients in addition to the public health. And having seen people with this disease die from this disease, I'm sure all of our listeners would agree that decreasing the prevalence is a priority. I would love to jump back to the JAMA Neurology article about Camp Lejeune that you mentioned. It's very interesting. It looked at over 158,000 service members at the North Carolina Marine Corps base called Camp Lejeune. And between 1975 and 85, service members were exposed to water that was contaminated with trichloroethylene, or TCE, and other volatile organic compounds. The study actually found that group had a 70% higher risk of Parkinson's disease compared to veterans at Camp Pendleton, as you mentioned, in California. But the prevalence difference was only 0.33% versus 0.21%. I think my question would be, when we're talking about percentages, obviously it can be very large, but the actual difference in prevalence was relatively high even in the unexposed group. So what is your interpretation of the study? Because I think some of the questions always become, statistically, percentage-wise, some things can be a huge increase fold over, but it was still relatively rare in both groups.
Yeah, it's relatively rare because the Marines were 20 years old when they were exposed. They were healthy. It's really hard to be a Marine without being healthy. They were only exposed for around 2 years. And average age of people at the time of follow-up was still like 58, 59. So this is a very young cohort. Despite being a young cohort, we find 70% higher rates of Parkinson's disease. I think they're understated, the results. Camp Pendleton was also contaminated with trichloroethylene, as are likely hundreds of military bases throughout the United States. TCE, in addition to being used in dry cleaning, widely used as a degreasing agent. And you can imagine lots of military bases were using TCE grease jet engines, machines, tanks, and the like. Dr. Sam Goldman and Caroline Tanner, they've only followed this cohort out to their late 50s. They did find prodromal features, including tremor, to be higher rates in those Marines who served at Camp Lejeune. The study is quite impressive in finding 70% increased rate of Parkinson's disease among people just in their 50s on average age. And for people who've only had 2 years of exposure is quite important.
So that actually brings up a question that I think is helpful for individuals trying to assess their own risk. Well, do you have a sense of the dose response, if there's a specific time in development when exposure to these toxins is most concerning, or if there's a threshold effect in terms of the length of exposure?
Hard to answer, but I'll give you some thoughts. One, is worth noting for all these factors that only a minority of people exposed to these factors are likely to develop Parkinson's disease, just like only 10% of smokers develop lung cancer. So only a minority of people, farmers, for example, are going to develop Parkinson's disease. For all these things, I think the timing of exposures is important. My suspicion is that earlier is actually worse. These chemicals can cross the placenta. The blood-brain barrier is less well formed. The brain is growing. The brain is dividing. And so these toxicants might have a greater effect on the younger brain. I think dose is important. We have really limited data to looking at dose response. We also know that there's a huge lag time. So the twin study that we referenced earlier from Dr. Tanner and Dr. Goldman suggested a lag of 10 to 40 years. So I think that these are much like smoking and lung cancer, that these things happen a generation or more after exposure. I think we could think about people who have occupational exposure and thus are being exposed to at higher concentrations. Those individuals may develop the disease in a shorter period of time.
Obviously, there's a lot more research that needs to be done, and epidemiological data for relatively low prevalence disease in a delayed manner is always hard to do. It's always a very hard question to study, as you allude to, especially when there's delayed effects and variable effects on individuals. The Guardian article you mentioned has a great map for anyone who's interested of the countries where Paraquat is still marketed. Are there any comparative studies across those countries? Because My understanding is there are some countries in the Middle East, like Oman, that actually have very high prevalence rates, but they're not included in the areas where Paraquat is marketed, although the factors for their higher rates of Parkinson's are unclear to me.
Yeah, so the three countries that, again, we have limited epidemiological data. The best data we have is likely from the Global Burden of Disease study. The three countries that have the highest rates of Parkinson's disease, I think, including the Global Burden of Disease study, are Canada, the US, and Argentina. All three of those countries, until very recently, last year, used Paraquat. So what limited evidence we have is concerning. Paraquat is just, I think, just the poster child for the worst offending agent of the pesticides, or the pesticide for which we have the most evidence linking it to Parkinson's disease. There are hundreds of classes of pesticides, or at least dozens of classes of pesticides. And many of these pesticides, some of them have been banned in the United States. They're still being used in other parts of the world. Overall use of pesticides in the world is rising. So these are all really, really concerning findings.
This is always kind of a fascinating topic. And certainly when I first heard you speak about it, I think grand rounds pre-pandemic, so quite some time ago now. It's not something that there's a lot of education about for students. I mean, I think in general, honestly, epidemiology is something that is challenging, requires a lot of additional expertise, and isn't always something that we as physicians get a lot of training in. What do you think moving forward as an overall field are avenues we can take, not just for this specific issue, but to arm ourselves to be better advocates on a public health level and an individual level for our patients?
So I think in American medicine, we have a significant flaw. We're really good at going from diagnosis to treatment, but we really rarely ask about going from diagnosis to cause. And stroke, for example, has made it huge changes. The incidence of stroke is declining, especially in the United States, because people have made that transition. Instead of just thinking about TPA and acute therapies, all of which are really important, people said, well, why are all these people getting strokes? And, smoking, all major factors, all addressable. And when we start addressing these causal factors, we see rates of stroke go down. We see disability due to stroke go down. We see economic burden of stroke go down. And so we need to do the same thing for Parkinson's. So if we don't ask why people are getting these diseases, we're never going to be able to create a world where future generations are largely free of these terrible diseases.
Thank you so much, Ray. It's been such a pleasure to have you here today and to hear you speak so passionately about this important issue of environmental toxicity and Parkinson's disease.
Sarah, thank you very much for having me.
That was Dr. Ray Dorsey, professor of neurology at the University of Rochester, interviewed by Dr. Sarah Stern-Nezer, neurointensivist at UC Irvine. ANA Investigates is the official podcast of the American Neurological Association. The show's producers are members of the ANA Education Innovation Committee, chaired by Megan Ritchie. I'm Adeline Goss, podcast host and executive producer. Our program was produced today by Sarah Stern-Nezer, Caitlin White, and me, with help from Jen Hurley. You can listen to past episodes of the show and access all of the ANA's educational programs at myana.org. That's it for ANA Investigates. See you next month.